Okay, so the first thing you're gonna do is make sure that you have an order for nitrous. Either the doctor can put it in or you can put it in under their name. You want this nitrous oxide, 50% oxygen, 50% nitrous. Once you have an order, then you can go ahead and pull your key out of the Omnicell under your patient name. All right, so the first thing we're gonna do is go in under your patient's name. You're gonna remove meds. And if you go to stocked meds, you go to, you have to almost put in the entire nitrous oxide key. You're gonna remove it. And here it is. Don't forget to return it afterwards. All right, so we're gonna pull out our nitrous. When you walk out the back doors of the ER, it's gonna be this closet, 0911. It should have some tubing on the top right here. So we can take this whole thing into our patient's room. If there's no tubing, the closet just to the right with the same code, 0911, has a bunch of extra tubing all on the bottom right here. All right, so you're gonna come into room 4 to get your mask. You're gonna go in under your patient name, and they're all at the bottom. They come in a couple different sizes. There's a pediatric, there's a small adult, a medium adult, I think a large adult. So you'll just wanna pick the appropriate size for your patient. All right, so we've got our Sentry Sedate, and we're gonna go check in with mom and child. We're gonna gel our hands real well before we go in. Hi.
Honey, just drink your Red Bull and calm down.
So we have a little forehead laceration and a lot of Red Bull, it sounds like.
Yeah, it was about 2 a.m. and she fell out of her bed.
Oh my goodness.
And hit her head on the coffee table.
Okay. We're gonna set this up. This is nitrous oxide so that we can kind of calm her down while we fix that laceration.
She's really scared of needles.
Okay, perfect.
Honey, they're gonna use a needle to repair No!
It's gonna be okay, honey. You won't remember. No needles. I promise, no needles. Can I just take that Red Bull? Can I have it for just a minute? Thank you. Perfect. So you need to have a recent set of vitals on your patient, including blood pressure, heart rate, and O2 sats before the procedure. They do not need to be fully monitored during the procedure, and it is not a one-to-one. You can set everything up and have a parent or mom hold the mask on for the duration of the procedure. All right, so the next thing we're gonna do is hook this up to the wall once we bring it into the room. You're gonna hook up both oxygen tubing and suction, but we have to remove these first. So you're gonna push the little lever in the back and just remove it and set it aside for the time being. And same with the oxygen. All right, and then to hook this up, it's pretty simple. You're gonna go green to green and gray to gray. So green will go, this in. Just plug it in like that. And then the suction, gray to gray, going like that. And you should hear it making this noise down here. That means it's set up correctly. Next thing we're gonna do is unlock our doors. So you're gonna use the nitrous key turn, and then you have to twist it to open. We're gonna do that on both sides. All right, so once we have our doors open and we're hooked up to our oxygen and suction and we hear the hissing sound, we're gonna find our oxygen key in this little bag here. These two tanks, you're gonna look for the one that says they're currently in use. These ones are in use. These ones over here are full. So we're gonna use these ones first. These ones are already turned off because they're the full ones. These ones, there's a little arrow, it's gonna tell you which way to turn. So if you're looking at it from the front, you're gonna go lefty-loosey. And I give it just a couple turns to make sure it's on. Same with this side, so you can feel it turn on. And just give it a few cranks. All right, so we have these two tanks on, we're ready to go, and these two as backup. So the next thing we're gonna do is hook up our tubing. The masks come in different sizes. I'm gonna make sure that it's the right size mask for my patient before I hook anything up or turn on anything. So, all right, honey, we're just gonna make sure this fits over your mouth and nose. Here, you can help me, watch, you can help me. Put your hand over there, make sure we have a good seal all the way around covering the mouth and nose, and we do. All right, so now we can go ahead and hook up our tubing. Our tubing comes like this. It's all one piece. It only goes on one way. So the first thing I like to do is this little L piece right here is going to hook up to your mask. So I make sure that's on in a good seal. The next thing, these only can fit one way. So the blue is going to go to this little bag, reserve bag here, and the pink is going to go over here. And just make sure you hook it up and have a good seal and you're kind of tight at this point. All right, so we're ready to go. All right, so the next thing we're going to do, we're going to make sure the physician is ready for the procedure, has everything set up, and we're going to get ready to turn this on. So this will be for the patient. The first thing we're going to do is turn the machine on with this on button right here. So it's on right now, but nothing is flowing yet. We're going to turn the oxygen up, and you'll see the gauge kind of go up. I like to get around like 5-6 liters. And you're going to see this bag inflate. We want to wait till the bag inflates. This gives us like a good reserve. So right now we can have the patient put this over their face. Go ahead and lay down, sweetie. Good job. And we're going to maybe have mom hold on to that. Do you want to hold on to it with your hand? There we go. All right, so we're going to have mom hold on to that right there and have her take some nice big deep breaths. We're going to go ahead and start turning up our nitrous until we get to 50%. We can titrate to patient effect. So if they start feeling a little woozy and they kind of don't notice what you're doing, that's where you want them. If at any point you need to just give them straight oxygen, this is the O2 flush. You can hold this down. And right now what it is, even though the nitrous is on, it's just giving straight oxygen to your patient. So if they complain of feeling nauseous or you have any reason to just give oxygen, you can do that. All right, and so we're all set up. Our nitrous is running and our patient feels a little woozy and is starting to get sleepy. So we're going to start the procedure with the physician and we're ready to go. All right, so reasons that the nitrous doesn't seem to be working. My patient's still being crazy.
Not working. Why isn't it working?
Right now, it's possible to kink this tubing. So you'll notice you don't hear the suction. This needs to be unkinked. So mom, move your foot. Perfect. There we go. All right. Reason number 2 that it might not be working is you're not getting a good seal. So, all right, Miss Riley, we're going to have you put your arms down and relax a little bit. And we're going to make sure we have a nice tight seal while we take some deep breaths. All right, a couple other reasons it might not be working. Make sure your nitrous is turned up and make sure your switch is in the on position. Make sure these are both connected. This tube is open and not kinked, and if it's still not working, make sure your oxygen tanks are open. If it's still not working, these might be becoming empty, and you would want to turn these ones on.
Your nitrous tank is always going to show at 750 once you hook it up. Once all the liquid in your in-use tank vaporizes, this gauge will finally start to drop. Once you see that gauge starting to drop, that means you have 3 to 5 minutes to switch over to your reserve tank. All right, so our procedure is done, our stitches are done. To prevent headache, we like to give about 1 minute of just plain oxygen. So you can turn your nitrous off and you still have your oxygen running, and then this flushes everything out of the bag when you push this. And just give them like about 1 minute of some like nice oxygen breaths so they don't get a headache. And then our procedure is done. We can turn everything off and we're gonna put this away. So first thing we're gonna do, this tubing is one-time use. We're just gonna unhook it all and this can go straight in the trash. And then we're gonna make sure everything is off in the off position. We're gonna turn our tanks off. So if it's left to open, it'll be right to tighten, and you basically just want to tighten it until it stops. So we're closed there, and we're going to close this one. All right, so those are both tightly closed. I'm going to put this back in the bag. I'm going to go ahead and close these up. So you're going to close these up, and you'll lock it with the key, and then we can go ahead and unhook these. So this one just gets loosely coiled on top.
And this oxygen cord gets wrapped around the back. All right, so then this can get locked up and go back into the closet, and we have to return our nitrous key under the patient we pulled it out of. All right, so we're just gonna go ahead and put this away. Don't forget to grab an extra tubing from the cabinet on the right to get it ready for the next person. So you're just gonna put one of these right on top. The code, again, 0911, we're super original. And then we're gonna go ahead and just put this away in this cabinet for the next person. All right, and then lastly, there's only one key, so we have to make sure to put our key back. So you can go in under your patient's name and you're gonna return. Nitrous oxide key will come up. And then return. Make sure you put it back in the right box. And it'll be ready for the next person.